Hello, Rodel Cueno. Hello.
Hi, ma'am.
Hello. O, kilala mo pa ba ako?
Ay, yes, ma'am. Good morning po.
Hello, good morning. Jeromel. Sino ba man nandini? Irene. Hi, Celeste. Hi, Doc Celeste.
Good morning, ma'am.
Hello, good morning. Kahit sa virtual, ay nice to see you. Ay, anong ginagawa mo na, Rodel, ngayon? Saan ka ba connected?
Ahente, ma'am. Drug supplier sa baboy sa manok.
Okay. Ay, ito si Irene.
Sa ano po, ma'am? Sa Asian Development Bank po.
Oh, wow, maraming pera, ha? About Jeromel. Saan ka connected?
Hello po, ma'am.
Hello, saan ka connected?
Ito po, host ng mga webinar. Sa health po ako, tapos sa Batangas Medical Center. Sumasideline lang po ng pag-host ng webinar para sa kapakanan ng ating mga...
Host ka na pala ngayon, ha?
Dito lang po, ma'am. Dito lang po, ma'am.
Okay.
Mini-message na po ako, ma-game na raw po.
Okay. Sige.
So magandang umaga po sa ating lahat. And welcome to the first Rural Class 96 Health Talks. This is a monthly activity aimed at public service for the betterment of the people who will be listening, covering different topics in the different fields then of our classmates. Now, to kick off the inaugural Rural Health Talks, I will introduce our speaker for this morning. Ayan. So our speaker is none other than our classmate, Mark Pasayan. He finished his undergrad BS Bio sa UPLB, major in microbio. Graduated Doctor of Medicine from PGH. He's a fellow of the Philippine College of Physicians and the Philippine Society for Microbiology and Infectious Diseases. Here to talk about a very relevant and timely topic in these times about COVID vaccination. We have none other than Mark Pasayan. Take it away, Mark.
Thank you, Dr. Jeromel. Can I call you Jeromel ba? Jero.
Yes, of course.
Wait, let me just share my slide. Sorry. Yeah, so good morning, everyone, and thank you for attending this lay forum or webinar. This is actually one of the activities of our class, the Silver Jubilarians for this year. And hold on, sorry, need to fix. Kita ba ako? Can you see
Yes,
my
we
slide?
see you, Mark.
All right. Siyempre ngayon lang tayo nag-ano ng slides. Kasi hold on. Yan. Okay. Okay. So can you see my slides now? Better.
Yes.
All right. So again, good morning, and I hope everyone can see me. And again, this is the project of our class, the Civil Librarians this year, and I was tasked to talk about the COVID-19 vaccination. And I'd like to give shout outs to my classmate, Dr. Egay Fuliante, our thoraco-vascular surgeon, for this initiative. And our other co-doctors in the class, Dr. Claire Habito, Dr. Jeromel Lapitan. And also I'd like to say hi to my first year high school science teacher, Dr. Ma'am Nerma Demanda. Hi, Ma'am. Thank you for attending. So let's talk about vaccine.
Hi, Mark.
Hi, good morning, ma'am. Let's talk about COVID-19 vaccine. I'm sure everybody knows her and you've seen the video. And let's talk about this girl na sabi niya natatakot siya. Bakit siya natatakot? Well, for the past 1.5 years, siguro the main reason why someone would get scared is because nag-positive ang kanyang COVID swab. And that has been our sentiments. That has been our fear for the past 1.5 years. Ang magkaroon ng COVID, ang ma-diagnose ng COVID. And if you have COVID, what will happen to you? And the fear is legit. Because we're like in one long dark tunnel. And being in this pandemic is like being in that tunnel. Because we don't know what's at the end of that tunnel. With all the hospitalization, with all the deaths that are coming in every day, with all the post-COVID complications, yung long COVID, the quarantine that we've been having since March 2020, the stigma when you are diagnosed with COVID. Of course, economic losses. A lot of people, a lot of Filipinos lost their jobs. Or if they keep their jobs, not being able to work in your regular workplace and just working at home. And for the vulnerable population, those people who are at risk of having severe disease. So there's a lot of uncertainties. But at the end of that tunnel, there is that glistening object that could be the source of hope for all of this, for all of us. And that's one vaccine. Now, why do we need the COVID-19 vaccine? Because we are still in a state of pandemic. Worldwide, we have 209 million COVID cases reported already, and this is as of August 19. And 4.5 million people already died because of COVID-19. In the Philippines, as of August 19, we have reported 1.78 million cases already. 30,600 people already have died. And in our region, Region 4A, 292,000 cases have been reported with 3,700 mortalities. And these are big numbers. Now, because of that, it's unfortunate for us, not that there have been a lot of vaccines developed since early second quarter of last year. May mga vaccines na developed, and different vaccine brand would have different vaccine types. It's not a one vaccine fits all. So there are the RNA vaccines, the Pfizer and Moderna. I hope you're familiar with those two brands. The viral vector vaccine, the AstraZeneca, and the Gamaleya, the Russian vaccine, and the recently made available in the country, the Janssen Johnson & Johnson vaccine. And there's the whole virus, the inactivated vaccines of Sinovac and Sinopharm. The Bharat Biotech is from India, and the protein subunit, which is not yet available in the Philippines. So these are the different types of COVID vaccines. And some vaccines, like the RNA vaccines, are the new kinds of vaccines that are made available for humans. There have been no vaccines before that was developed with this kind of technology. And Sinovac, the Bharat, and the Sinopharm are inactivated virus, which is the same vaccines or the same type of vaccines that we have for rabies, for hepatitis A, or even your HPV or cervical cancer vaccine. For the viral vector, well, it's also a new kind of vaccine, and the only disease where a vaccine was developed using this technology is the Ebola virus disease. So, ano ba yung mga vaccines na available sa country? So, there are only 8 vaccines that have been given the emergency use authorization by the FDA. And I'm sure you've heard a lot of them already, since we've been rolling out this vaccine since March 2021. So we have the Pfizer, the AstraZeneca, the CoronaVac, the Gamaleya Sputnik, the Janssen, Bharat, Moderna, and the Novavax. And I'm sure if you have received the vaccines already, you have experienced some of the side effects, but these are natural or normal side effects that we get from vaccines. And compare that dun sa mga symptoms of COVID-19. These side effects are actually a common thing for any vaccine. But if you have COVID symptoms, syempre doon mo mas mararamdaman or doon mo ma-experience ang severe signs and symptoms of the infection. Because COVID, the vaccines are inactivated viruses or just parts or particles of a certain virus, and it will not give us the symptoms that we experience if we ever will have the natural infection. Okay, so when can I get my COVID vaccine? I don't know among our participants now who among you have not received the COVID vaccines yet, but maybe we just need to wait because this is what's happening around the world globally. There's really vaccine scarcity. Number one, the Philippines do not produce the COVID-19 vaccines. We rely on other countries. We rely on WHO for our vaccines. And looking at our numbers now, this is a vaccine rollout. So this percentage on the left side is the percent population. Look at Singapore. Almost or more than 70% of their population have been vaccinated. United Kingdom, 60%. The whole European Union, more than half of the population of the European Union, as well as the United States, have been vaccinated. But look at the Philippines, Indonesia, Thailand, more than just 10% of the population. But what's so striking is the whole continent of Africa, wala pa yatang 5% ng population nila ang vaccinated. So there is what we call vaccine inequity. Meaning, hindi lahat ng countries would get the amount or the number of vaccine doses that they need for their population. And unfortunately, high-income countries would get the big bulk of the vaccines being developed. Well, that's a reality. That's the social inequity. And we have vaccine inequity as well. So if you're a high-income country, most likely 50% of your population have been vaccinated. But if you're in a low-income country, wala pang 2% ang vaccinated. And this is as of July 2021. And this is recognized by WHO. And this is actually one issue that WHO would like to address, how we can distribute vaccines to almost all countries around the world. And what's the update now in the Philippines? What share of our populations has been partly or fully vaccinated against COVID-19? When we say fully vaccinated po kasi, it means you have received the 2 doses of the COVID vaccine, and it has been 2 weeks since your last dose or second dose. After 2 weeks of your second dose, then you may say that you have been fully vaccinated, except for Janssen or Johnson & Johnson, because Janssen only requires you to receive 1 dose. So 2 weeks after the Janssen, you are considered as fully vaccinated. So what are the numbers? This is from our data in the Philippines. Imagine only 15% of our population has been vaccinated, 12% fully vaccinated, and 3% partially vaccinated. Ano yung exact number dyan? Only 16.25 million of our population out of 111 million Filipinos have been vaccinated, and around 13 million have been fully vaccinated and only 3.37 million partially vaccinated. So we're a long way to go pa before we could reach that tinatawag na herd immunity. And herd immunity is vaccinating 60 to 70% of a population. And we are just in the 15% of the population, way beyond the target na 60 to 70%. So, ang bottom line, when it is your turn, play your part and get vaccinated. I'm sure a lot of people are waiting to get vaccinated. I'm sure a lot of people are waiting for the text message from the LGU or barangay health worker that it's their time to get vaccinated. So if it's your turn to get vaccinated, get the shot, regardless of the brand, regardless of the type. Because getting vaccinated can protect you. It could protect your family. It can protect your co-workers. It can protect the whole community. And that's what WHO is saying. Why? Because there have been data showing that COVID-19 vaccines help to stop you from picking up the virus and spreading it to others. And your decision to get vaccinated does not only help you, does not only help your family, but it also helps the whole community. And this protection is not 100% because there's no definite 100% in vaccination, but it will still prevent you from getting severe disease. So continue to still take precaution even after vaccination, and that's what WHO has been recommending to a lot of people, to all people who got vaccinated. But the good news is all WHO listed vaccines, meaning all the 8 vaccines that are approved for the Philippines, do protect against developing disease, against hospitalization, and against death due to the Delta variant. And that brings me to this topic, the Delta variant. What do we need to know about the Delta variant? So like what I said, the Delta variant came out because of the mutation doon sa original virus. And there have been a lot of variants coming out right now. Recently, we have the news about the Lambda variant from South America, but there are actually just 4 variants of concern: the Alpha, Beta, Gamma, and Delta. And the most notorious one is the Delta, because it is twice as infectious as the original strain and about 50% more infectious than other detected variants of concern. But what we must understand is that vaccines that we have right now are effective against against the severe illness and death caused by the different COVID-19 variants, including your Delta. And most people infected by Delta are actually those who are unvaccinated, and they have a higher risk of developing severe symptoms that require hospitalization. Now, the question now is, if you are vaccinated, and I'm sure most of us have been vaccinated already, what's next? What's next after vaccination? If I get vaccinated, when will my immunity kick in? Actually, after the first dose, meron ng immunity, no? But the immunity might not be as good if you receive the second dose as required. And the second dose is actually your booster to strengthen the immunity. And like what I said, you are considered as fully vaccinated 2 weeks after your second dose. Now, how long will you be immune to COVID-19? Will it be lifetime? Will it be just a few months? Will it just be just a few years? Well, actually, no one knows yet. There's no data yet on how long immunity will last. Several studies have come out already in the past months. They say 6 to 8 months. That's why there are now a plan to get the booster maybe next year. And that's in the United States. That's what the United States CDC will be recommending soon. But whether we will have lifetime immunity to the vaccine that we received, no one actually knows. OGK, only God knows. Now, can I catch COVID-19 and infect others even if I am fully vaccinated? You know, vaccines protect people against severe disease. It will not protect you from getting infected. Because you can still get infected, but since you are immune, hindi ka magde-develop ng severe disease, or worse, you will not die from the disease. Can you get vaccine? Can the vaccine protect people from getting infected? The answer is no. But can the vaccine protect people from transmitting the virus? Maybe. Because if you are vaccinated, less likely that you will be symptomatic if you have the infection, and less likely that you will have severe disease. So less likely then na ipapasa mo yung virus sa ibang tao. Because studies have shown na if you are vaccinated, yung viral load mo is actually very low compared to someone who is unvaccinated. So what is important to know here is, that we should understand what vaccines do. Breakthrough infections are possible, but it is rare. And your symptoms, if ever you get a breakthrough infection, are more likely to be mild. I like to show you this Philippine General Hospital data. This was just released last week. No, we all know that we are in a surge right now. This is actually the third surge since March 2020. And we've seen a lot of cases recently, even in private hospitals in Laguna and Batangas. There have been a lot of cases, and all hospitals are in full capacity. But looking at this Philippine General Hospital data, among their COVID patients admitted, 265 of them, 187 are unvaccinated. That's 70%. And among those patients who are admitted in their ICU, 9 are unvaccinated out of the 13, and that's 70%. And among those 8 patients who are in life support machines, the mechanical ventilator, 6 are unvaccinated, and that's 75%. So, ano yung bottom line ng figure na to? Most of the people who are admitted now and who are critically ill are actually unvaccinated people. And that's the value of getting vaccinated, for you to not have a severe COVID-19 disease. As for the side effects, this is the different vaccines that have been rolled out in the country since March 2021. And like what I said, no, around 13 million doses or 15 million doses have been rolled out. And so far, the number of people who got COVID-19 after the vaccination is very low. There's one report of death in Sinovac, but this has to be verified. But relatively, this is very, very, very low. Comparing based on the number of doses that have been given already. And this is a report from the DOH and the US CDC. Among the 9 million vaccinated people in the Philippines, the rate of infection is as low as 0.0013%. And for those in the United States, it's actually 0.003%. So that's very low. Among those, the risk of infection is very low among those who are really vaccinated. Do I need to continue with the precautions even after vaccination? Well, the answer is definitely yes. Hindi ibig sabihin na bakunahan na is you can just roam around the mall not wearing anything, or you can gather and have parties just because you are vaccinated. I saw this post from one of my relatives in the United States. Just because they are vaccinated, it's okay now to do mass gathering and go to the Universal Studio. So, and that's wrong. Because vaccine is just one layer of protection. This is the Swiss cheese model. The Swiss cheese model tells us na, the Swiss cheese has holes, and if you have different slices of cheese and you put them all together, kahit na may mga holes yung slices ng cheese, you cannot pass through all the layers of the Swiss cheese. And that's how that's what this model is telling us, that one layer is not enough, one slice is not enough. Vaccine is relying our protection on the vaccine is not enough. We need to still do physical distancing. We need to still make sure that ventilation is good in our workplace. We need to still wear masks, do hand hygiene, and down the line. So, and that's the only way that we can be safely protected against COVID-19 if we put all these slices or layers together. Now, another question here is, should we have a third dose of the vaccine? Given the efficacy and the availability of the COVID-19 vaccine and the paucity of evidence, having the third dose or booster is actually not recommended for the general public at this time. And this is a recommendation of our Society of Infectious Diseases. The vaccine are in short supply. And like what I showed you a while ago, we are still competing with the high-income countries for our own supply of vaccine. So we do not have enough vaccines in the community to protect everybody. So let's just continue the rollout for the rest of the population, and before we could get the third dose. Sabi nga ng isang ID sa isang webinar, isang infectious disease specialist sa isang webinar, it's just like queuing up in a buffet, no? Hindi pa nakakakuha yung ibang tao, kumukuha na yung iba for their second serving. So for now, it is not recommended to get the third dose or the booster shot, but maybe next year, who knows? When we have already rolled out the vaccines for the Philippines, we can get the third dose. Now, let's talk about vaccines in children. And that's a question. Should we get children vaccinated now for COVID-19? And the answer is because children are less at risk in getting severe disease, and we do not have any evidence yet for the use of these COVID-19 vaccines in children. The pediatric infectious disease experts are recommending that older and more vulnerable adult age groups should still be given precedence in the vaccination rollout. Meaning, hindi pa po. Hindi pa siya i-roll out sa children, for people less than 18 years old. Probably you've heard that Pfizer is now recommending Pfizer vaccines for children 12 years and above, but that's in the United States. And in our local setting, our doctors are telling us not to give vaccines yet to the pediatric population. So how will these children be protected? Well, it's through an umbrella. The umbrella would be coming from us. Until the vaccine is approved for kids less than 12 years old, children are actually relying on their adults in their lives for protection. So if we get vaccinated, if adults get vaccinated, then children will be protected, and that's herd immunity. Now, how about the pregnant or breastfeeding women? Can I get the vaccine if can a pregnant woman get the vaccine if she's pregnant, or a breastfeeding woman? And the answer is yes. Individuals who are or will be pregnant should receive the COVID-19 vaccine. COVID-19 vaccination is recommended among breastfeeding women. And the recommended brands would be Pfizer, Moderna, Sinovac, AstraZeneca, J&J. Sputnik is the one recommended for breastfeeding women. Okay, so kanina pinakita ko sa inyo si Julia. At bakit natatakot si Julia? Dahil nag-positive ang COVID swab niya. And that's, like what I said, that's what people are experiencing now and in the past 1.5 years. The fear that you might get COVID-19. And minsan, meron talaga mga tao na hindi tayong protektahan. Minsan may mga relasyon na hindi tayo kayang protektahan. Pero huwag kang mag-alala, meron naman tayong bakuna na pwede mong asahan. And I just can't believe na papa-OMG ako sa sinabi kong yon. Yun lang po. And for my last slide, again, on behalf of our class, UP Rural High Class of 1996, would like to give this message to everyone. Now, to stop this pandemic, to end this pandemic, we should do everything. Keep a safe distance, wash hands, wear a mask properly, get vaccinated when it is your turn, and encourage everyone to do their part. Magandang umaga po and salamat po sa pakikinig.
Thank you very much, Mark, for that timely and very clear presentation on the relevance of getting vaccinated and its importance sa panahon ngayon. Now, we will open the floor for questions. If you want to ask something, just raise your hand so we can recognize you, or type in the chat box. But I'd like to start with the questions by asking Mark, in your personal experience and off the top of your head, what were the most common things that patients who are hesitant in getting the vaccine tell you, and how do you enlighten them or convince them otherwise?
One reason why a person would be hesitant to receive the vaccine is because of the brand. I think it's because of the brand. And there is that misconception that one brand is not as effective as the other one. We want the high quality brand. So that's one reason. The second one would be out of fear. Fear because this is a new vaccine, fear of needles, fear of the side effects. And number 3 would be among the list would be because what's seen, what's heard in social media. So I think those are the 3 things that would discourage or that would scare someone to get vaccinated. As for the branding and the type, all these vaccines are effective. And like what people have been saying before, the best vaccine is the one that's available in front of you. The best vaccine is the one that's being given to you right now. And if you look at the numbers, konti lang po ang vaccines na available sa Pilipinas. And if it's right there in front of you, grab it, grab the opportunity to be protected. Because it's very difficult to get sick. It's very difficult to get COVID, and it's even more difficult to be in a situation where your health and your life is at risk because of this disease. As for the fear, well, the fear is legit. It's a new vaccine. It's something new. It's the first time that that humans will get this kind of vaccine. So the fear is legit. But just remember that there have been a lot of studies already on coronavirus before. There's MERS, there's SARS in 2003. So there have been already ongoing studies, and hindi ito minadali. It's just so happened that we are in a state of pandemic, and all the resources and all the researchers on vaccines came up with these effective vaccines in the past year. As for the social media, well, we are in a state of pandemic, but we are also in a state of infodemic. There are a lot of talks, there are a lot of opinions, and it's a free country. It's a free world. Everybody can voice out their opinion. But then one thing that we should remember is we should trust science. We should trust our experts, and everyone is doing their part, their best to save everyone, to protect everyone. And science is doing its role right now. That's why we have Dr. Dimaandal here. Because trust Dr. Lerma Dimaandal, trust science. Yeah, now.
Yes.
And
That's very important. No? That's important, yung trust sa tamang source. Because I remember I had a patient who has the same fear, dahil yun daw yung sinabi sa Facebook, sa social media. And what I told my patient is, if you get sick, the people on Facebook, they will not care because they don't know you. But I know you, you've been my patient for a very long time. And if you get sick because you did not get the vaccine, I will feel some form of sadness on a personal level. So sometimes something like that is what our patients need, di ba? Yung implications kasi of not getting the vaccine because of what a stranger on the internet told them. They don't realize that it will not matter to the person who made that post, who made the disruptive post, but it matters to us, the healthcare providers, if our patients are well or sick. So yeah, that's a very good point, Mark. And I was told na hindi nakakapag-raise ng hand. If you want to ask, may question si Sarah. What is your fearless projection based on current figures as to when the pandemic will end? Or do you think it's still attainable, yung herd immunity?
Actually, actually I thought the pandemic will end last year, nung summer last year. Because since nung nag-practice ako as ID, there have been two emerging infectious diseases na. One is Ebola and the other one is MERS. Ebola did not reach our country. MERS, we had like 4 or 5 cases only. So parang nung nagkaroon ng news last January, there's a new disease in China, ang thinking ko na it won't reach our country. Until boom, February came in, and we had the Chinese tourists getting positive. And March, or first week of March, nandun na yung local transmission sa Philippines. And thinking ko noon, okay, nandito na pala, so mukhang magkakaroon na talaga ng COVID sa Pilipinas. But then thinking ko is, hindi yan talabas, hindi yan tatagal ng after Holy Week. Because maybe the temperature will kill the virus. I don't know, because that's my experience sa MERS and sa Ebola. Hindi naman ganun talaga nagtagal. And then tumaas na yung kaso, and I thought, hindi yan tatagal din ng Christmas. Ang Christmas siguro wala ng COVID. But then tapos na yung Christmas, and then ngayon lalabas na ulit si Jose Marichan, meron pa rin tayong surge. So if you ask everyone, the ID people, when this pandemic will end, again, only God knows. We don't know when this will end. Maybe years from now. Maybe it will be just the it will be just like the flu. Na it is a common thing every year. Maybe we're going to have the booster shots next year, and the COVID-19 vaccines will be just like receiving your flu every year. So there's a lot of maybes because actually no one knows when this will end. No one knows when we could go out without our mask on. When we don't know when travel will be allowed freely. So let's hope and pray that this will soon end. And when will our herd immunity be achieved? Well, if we vaccinate and we get immunity sa 60 to 70% of the population, and that's 60 to 70 or 80 million Filipinos being immune to COVID-19.
Yeah, the thing about yung sa parang flu, I don't know if I remember reading recently na in Singapore, I think they stopped counting the COVID because they have herd immunity. So they treat it as yun na nga, parang flu na lang, and then baka ganun na rin sana ang mangyari for the rest of the world as soon as we get the herd immunity. Rona was raising her hand earlier, but she typed her question. I'd like to read it first. Is there a prescribed physical conditioning or preparation before getting your shot that would help minimize or avoid side effects?
No particular physical exercise. So that's what you're asking, Rona. No particular preparation. Siguro lakas ng loob, tiwala sa sarili at sa siyensya. It's not advisable also to take paracetamol or any anti-allergy before getting vaccinated. Only if after vaccination magkaroon ng symptom like fever or allergy, that's the only time that you need to take medication. So there's no specific preparations for vaccination. Siguro magbaon na lang ng tubig at pagkain kasi mahaba ang pila. Yun ang kanilang complaint minsan, nagutom na sila sa pila.
Dok, kala ko sabihin mo dasal.
Dasal din. Pwede tayo makatapos ng isang 5 mysteries ng rosary habang nag-aantay.
Thank you.
Yeah, buti nga ngayon medyo maulap na, di katulad nung kainitan, di ba?
Tsaka they do it sa mall. So medyo comfortable din minsan kung nasa mall.
No, syempre sa Los Baños wala namang mall, di ba? Sa siya ginawa, sa basketball court sa Batong Malaki, nainitan yung mga senior na nagpunta doon. But yeah, that's it. Kasi before nauso yun, di ba? Sasabihin, ito yung take mo, pero hindi na ini-encourage.
Yeah.
One direct message question is that this the vaccination program has divided the people into pro and anti-vax. Karen is asking if we have data on how many people are pro-vax na.
I'm sorry?
Yung data, the number of people in the Philippines are vaccination.
Well, it's a very difficult very difficult to study pero I don't have any data on the anti-vaxxer rate in the Philippines. Probably you'll just see them lurking around in social media. Ang lagi ko sinasabi, when I talk on vaccine, if you look at your right or left shoulder, you'll see a scar. And that scar is a reminder to all of us that when we were babies, we got a shot that made us protected against primary complex of tuberculosis. And we were babies then. We never had the choice. It's the choice of our parents, of our pediatricians to protect us so that we will grow up healthy. And we should be thankful for that. Right now, we are in a pandemic and we have a personal choice. And that choice can save our lives and the lives of other people. So it's a matter of understanding why we are doing it and why we could be protected for doing it. And we should be also thankful that we have the chance to get the shot.
Yeah, primary complex or TB kasi parang ano hindi na pinapansin. Pero hindi alam ng mga tao, 'di ba, kung gaano katindi din kung magkaka-TB ka.
Or
Yan
even
tagal na ng
or
TB.
even polio, polio,
Yeah.
chickenpox, measles. All these were given to us when we were babies, when we never had a choice. We never were not able to decide for ourselves when we were babies. But it was a decision made by our parents, and that helped us a lot.
Yeah. And we sometimes take that for granted kasi eto may tanong ito, si Reg to asawa ni Egay, si Dr. Reg. Gusto daw niyang takutin ng mga kapitbahay na ayaw magpa-vaccinate. Magkano daw ba kung ikaw ay mapapa-hospital pag nagkaroon ka ng severe COVID? Magkano nga ba, Mark?
Dr. Reggie, magkano? May PhilHealth or wala? The usual hospitalization right now, honestly speaking, hindi po bababa ng 300,000 for a moderate case. And if you are critically ill, hindi rin bababa ng 1 million.
Grabe.
Pesos.
Magpabakunan
1 million
naman,
pesos.
Libre naman eh. Libre naman
So,
magpabakunan.
libre ang bakuna, mahal magpa-hospital.
Yes. Irene has a question for those already fully vaccinated and considering booster shots once authorized. Should they stick to the same brand or parang try another? How do you think that will happen?
Yeah, Irene, no data yet on what brand yet. But Pfizer, for example, well, it's Pfizer, it's a private company. So they are recommending the same brand, but that's being cascaded now in the US. Ang ano lang asin natin dito is tingnan natin yung ibang bakuna, ng ibang sakit for hepatitis B or even flu. We also change brand, no? So there's no recommendation yet on what booster you'll get if ever the booster shots will be rolled out, whether you can receive a different brand or a different type of vaccine. But one thing is for sure, in order for us to be protected against the new variants, there should be a different vaccine. Because that's what we're studying now. There should be a different vaccine. And this vaccine should come from the variants that are emerging.
Parang sa specific na dun sa
Yes.
variant.
Kasi yung
Kanina
vaccines,
pala, yes.
yung vaccines na lahat ng ito, they came from the original, the wild type virus. And we have a lot of variants now. So if ever there will be new vaccines that will be given next year, it will be coming from the new variants.
Yes. Kanina meron tayong shout out to the importance of science. At nandiyan si Ma'am Dimandal. And I was told nandito rin si Ma'am Quintana. Yan. So mga science teachers natin, nandito na kasama natin. Science teachers
May
back in the day.
question ako, Mark.
Yes, ma'am.
Yeah.
Good morning.
I received AstraZeneca, no? First dose and second dose. On the first dose, on the day of the first dose, I didn't experience anything. But on the second day, I experienced nausea, hypertension, my BP reached up to 200, and then severe dysentery. Is that normal?
Yes, ma'am. For AstraZeneca, especially, no? Sa AstraZeneca talaga, the data showed na mas mataas yung adverse effects on the second dose. Probably because you have the antibodies na to the COVID-19 vaccine, and when you receive the second dose, mas nag-enhance tuloy yung effect ng vaccine because you have the antibodies. So it's a common thing, ma'am. Nothing to worry about that.
Okay.
And congratulations for being fully vaccinated.
Okay. Second dose normal. So that lasted for almost 3 weeks. Oo.
But how are you now? How are you now, ma'am?
Okay, back to normal.
Back to normal.
Yes, healthy again. And back to teaching online. Okay. And then Ay, happy birthday, Prof. Q. It's her birthday today. Wish her birthday. Happy birthday.
Happy birthday, ma'am. Or ay, Ma'am Quintana.
Thank you for
Then,
joining us this morning. Thank
ay,
you,
another
Amanda.
question. Those
Yes,
who
ma'am. Go ahead.
received Janssen and Janssen vaccine, why is there no second dose?
Ma'am, because that's the recommendation. That's how the vaccine was manufactured, that you only need
Ah,
first dose. And that's actually just if I'm correct, that's the only vaccine actually that should be given for one dose only.
okay. Thank you.
Kaya maraming gusto po ng Janssen ng
Oo
Johnson
nga.
Johnson kasi
Yes.
isang pila lang.
Oo.
Wala lang din tapos na. So,
Only once.
siya din yung pinakakonti na bakuna na binibigay sa Pilipinas. Ang bakuna po kasi na dumadating sa Philippines ay some less than 50% binibili ng gobyerno, while the rest are donations ng WHO or donation ng mga ibang countries like US and China. So we get our vaccines from the COVAX facility, which is the distributing arm ng WHO for all countries.
Ay, is it true that those who receive Sinovac cannot go abroad? Is that a fact or a myth?
Ang ano kasi ma'am, for example, sa US, they want the vaccination record. So it's not really a restriction because I know friends, I know colleagues who are in the US right now and they receive Sinovac and they're there. But I think it's just a recommendation that if ever you'll be entering a particular country, there would be the recommended vaccines. For example, European Union, syempre, they want AstraZeneca. Or Moderna or Pfizer.
Pfizer.
Same goes with the US.
Okay.
But if for now, siguro dyan lang muna tayo ma'am sa Batangas, Quezon, at saka Manila.
Parang yun yung question, ano, Mark? Parang kung hindi naman kailangan pa umalis muna ng ibang bansa, right? Dito muna tayo.
Virtual tour
Tapos,
muna.
Virtual tour, yan. Maraming ganyan sa YouTube. Ano? I want to answer the question of Nick here. Kasi yung sa pag-trust, diba, sa science and all these data that you presented, ano daw kaya yung pwede nating magawa para ma-increase yung awareness natin sa science?
Well, similar to what we're doing now. Speaking out, telling people on the facts and how everything is being done based on clear-cut evidence. Mahirap din kasi talaga. And you cannot push people kung sino or saan sila makikinig or maniniwala. But siguro that's one contribution natin to public health is to relay important information, valid information so that people will learn.
Yeah, I think it matters na ayan, pinaniwalaan natin yung mga science teachers natin. Kaya tayo yung naniniwala din sa kanila.
Galing lang yun. Naniwala tayo sa kanila. So maniwala din tayo ngayon sa siyensya. Sineskwela lang.
Eskwela. Thank you po, ma'am. Si Ma'am Quintana, she's literally raising her hand. Ayan, let's recognize her.
Oh, thank you, Jeromel. Naniniwala nga kayo sa mga science teachers nyo. Hi, Dr. Mark.
Hi, ma'am. Good morning.
Hello, everybody. Thank you so much for your birthday greetings. Ang daming callers, kaya hindi ako agad. May tanong ako, Dr. Mark, kasi kanina nga nabanggit ni Lerm, sabi mo pati yung Sinovac, yung going abroad. Kasi yung youngest daughter namin nasa Australia. And you know how strict is Australia sa mga travel as compared to the US. Gustong-gusto talaga ni Maricar na makabisita kami doon pagka nag-ano na, pag nag-open na yung na-lift na yung travel restrictions, hi Romel. Ngayon, Sinovac lang kaming dalawa, mag-asawa. Okay? Fully vaccinated na. Pero I heard na mayroon bang how many months lang yung efficacy nung Sinovac. Nung March kami na May kami na nabakunahan. Okay. So ilang buwan ba talaga yung kasi ang suggestion ni Maricar magpa booster dose bago kami mag-apply for Australia kasi hindi raw talaga tinatanggap doon yung Sinovac. So ilang months ang dapat ihintay namin? At saka pwede ba kang magpa-third dose ng hindi Sinovac?
Okay, ma'am. Let me just digest mo yung mga question. As to the how long will you be immune to Sinovac, to COVID if you receive Sinovac? So let's base this doon sa experience the first SARS noong 2003. So there's the first SARS-CoV noong 2003, and there have been vaccines developed for SARS-CoV of 2003. Hindi lang siya na-roll out, but clinical trials were done for that. And they found out that there's actually no lifetime immunity for this vaccine.
Yeah.
And relative din kasi siya nitong SARS-CoV-2, which is COVID-19. So we expect that lifetime immunity might not be reached even if you get vaccinated or even if you had natural infection. And based on the current studies, the results of the current studies, 6 to 8 months lang talaga ang immunity. That's why people are now, or experts and scientists are now thinking of rolling out the booster shots. But for the booster shots, there are no recommendations yet from WHO for all patients or for all people who receive the COVID-19 vaccine, especially in resource-limited settings like the Philippines or in Asia. Now, can you get another booster shot of Sinovac in the Philippines? None yet, ma'am. It's not yet recommended and mukhang hindi pa rin papayagan ng LGU or nung vaccination site for you to receive that second or for the third shot. Why? Because there is still no concrete safety and efficacy data for the third shot. Now, can you receive a third shot na ibang brand?
Yeah.
Again, no safety and the efficacy data yet, but people do it. People do it because they were able to get it in the United States. So people who are vaccinated in the Philippines for, let's say, Astra or Sinovac, when they get to the United States, they get the Pfizer shots because Pfizer vaccines is available sa kanilang mga pharmacies, and we know how very common ang mga pharmacies sa US. So ang sa akin, ma'am, if you're going to Australia, if they don't want travelers with Sinovac vaccination record, maybe that could be a problem. But another option would be to get the Pfizer or AstraZeneca shots in Australia. But again, the data on efficacy and safety is really not yet very clear.
Okay, thank you so much. Another question, please.
Yes, ma'am. Go ahead.
Ma'am, para sa inyo.
Okay, yung Sinovac, first dose, second dose, wala man lang akong naramdaman. Sabi ko nga, baka naman placebo ba yon? How is that the way? Although yung husband ko, meron siyang after the second dose, nanakit yung katawan niya. Ako wala. Does that mean to say hindi nag-activate yung aking antibodies?
Not necessarily, ma'am. Not
Oh,
necessarily. Ako rin, I received Sinovac, but I just
oh.
had very, very mild symptoms on my first dose and no symptoms at all on the second dose. Because these symptoms actually, the side effects from the vaccine is actually not because of the viral particle, but it's because of the adjuvants, because of the different components in the vaccine that is triggering response sa body natin. So if you did not experience any adverse event, that's okay. It doesn't mean that it's not working, because we still have antibodies produced regardless kung may adverse events man or wala tayong receive after vaccination. Same goes with the flu vaccine. Sometimes you get adverse events when we get the flu shots, sometimes walang effect.
Okay.
No
Oh,
worries, ma'am.
thank you so much. Ang dami-dami ko pang greeters dyan, ha? Thank you very, very much. Oh, thank you. Naku, sila Maureen, you're all very thoughtful. I'm so proud of this living trophies namin ni Teacher Larma. Kayo lahat, we're so proud of all of you at saka yung mga ginagawa nyo for rural high school.
Correct.
Napaka, I'm sure God will bless you more because you know how to look back, you know how to be grateful. Yun na ang kulang ngayon eh. Sa mga kabataan, but you still have it. We really, really salute you for all of that. We are so grateful.
Thankful.
Maraming salamat sa inyo lahat. God will bless you more sa lahat ng endeavors ninyo. Ilan na lang kami nila Ma'am Lerms na natitira. Kukunti na lang kami. Okay. And so, kami na nagre-represent ng lahat ng mga naging teachers nyo, pati yung mga nauna na sa langit. Okay. Sana magkaroon pa tayo ng alumni homecoming ulit na face-to-face, no? Let's look forward to that. Okay.
Yes,
Yes,
correct.
ma'am. We will surely will. We will surely will.
Oo.
So,
Thank you
Dr.
po, ma'am. Thank you po. Ay, okay na. Okay na tayo, guys. Okay na daw, sabi ni ma'am. Okay na tayo. Good job tayong lahat. Sige. I think we only have time for one more question. So I want to read this last question. How do you distinguish fever from the vaccine versus the real COVID? Parang siguro kung nabakunahan tapos nilagnat, ano bang gagawin natin para dyan?
That's why before you get vaccinated, you need to check for any symptoms. No, so just make sure na wala kang symptoms of COVID or any other infections before the vaccination. Because if you get vaccinated and magka-fever ka, it's very difficult to distinguish whether this is vaccine effect or this is actually a legit or a real infection. But if this is because of vaccine, it usually lasts for only 1 to 2 days. But if this is because of something else, then definitely you need to have yourself checked. Si Prof. Lerma dapat nagpa-check kasi 2 weeks yata yung kanyang effect. Baka it could be something else, ma'am. But for vaccine effects, it's just temporary and it's easily managed by taking some paracetamol or anti-allergies.
I had medical check-up.
That's good. That's good, ma'am.
Yes. Thank you. Thank you again, Mark. Now, there really are a lot of questions, but we need to stick to the time schedule because we know, syempre, marami rin gagawin yan si Mark. So, i-segue ko na, Mark, for the people who want to get in touch with you and see you in their clinic or have some questions, maybe face-to-face or online, how can they get in touch with you?
Hindi ako ready sa promotion.
Kailangan ready.
Well, I practice sa Laguna. I'm affiliated with Calamba Medical Center, Medical City South Luzon, and Quali Med in Santa Rosa. These are the big COVID hospitals in Laguna. And if there are any concern, any help that I could offer, just message me in Facebook or text me or yeah. Or
Ayan.
get in touch with Jeromel. Jeromel is also our doctor in Los
Get in touch
Baños.
with Ay, ang game ba
Yeah,
yun?
Dr. Claire Habito, Amy
Yan.
Barion, sino ba? Ben Gelarmino, and Egay Fuliante, of course.
Si Egay din. Pwede rin makipag-online kay Egay kahit nasaan, di ba? Kahit nasa
Okay.
Batangas ni Egay.
Kung
Pwede rin mag-online.
hiwaan po ang gusto ninyo, Egay Fuliante ang nandyan.
Yan. Pag yung mga tubig-tubig sa baga. Yan. But yeah, maraming salamat Mark. And maraming salamat din po sa mga participants natin for your questions. So to end our session, let me share this promotion ng aming batch. Just if you're interested, may fundraising din kasi ang aming batch. If you're interested to get this merch, just scan the QR code to get this merch, order them. I think you can get the bundle para merong discount. And for next week, yan, nawala. Next week, nawala yung aking sinishare. Doing what matters in times of stress. We will be announcing it again dun sa Facebook page. And ano yung isa pang nasa script ko? Recording of this event will be posted and announced din dun sa Facebook ng alumni if you want to catch a recording of this video, this morning session. So muli, on behalf of the organizers, maraming salamat po sa mga kasama namin behind the scenes. And salamat ulit sa mga participants. Good day and God bless you all.
Thank you.
Okay,
Ingat
thank
po.
you, Batch 96. Thank you very much for the invitation. God bless everyone.
Ingat